At this point, we're going to focus back on our patients, and Dr. Richard Huggins is going to take over and provide some updates on patient experiences. Dr. Huggins is coming out one of the most successful engagements with the FDA on any skin disease topic. So we'll let him speak a little bit about that and get the patient perspective with Andre and other groups. Rich, I think you're on mute.
Sorry about that. Yeah, so I'm going to lead off our discussion, and then you're going to hear from two of our outstanding vitiligo support group leaders, Valarie and Andre. But if we can pull up my PowerPoint, I will get us started. And while we're waiting, okay. All right, there we go. So I'm going to start off just by giving you guys a brief update of the Global Vitiligo Foundation community, aka the GVFC. Next slide, please. And so the GVFC is the community support section of the GVF. Our main objectives are to encourage and facilitate vitiligo support group collaboration, as well as to deepen connections between vitiligo support groups and the individuals they represent with the medical community of vitiligo. And we are affiliated with over 25 member groups. We have more of a national focus, but as you can see, we do have some ties with some of the international vitiligo support organizations. Next slide. So our webpage is embedded within the GVF's website under the support resources tab. Next. And okay, we also have within our website a support group directory which can be very useful for individuals out there with vitiligo looking to connect with support groups. One of the most important and most fun things that we do with the GVFC is our quarterly open teleconferences, where we have vitiligo support organization leaders from around the country come on and update one another regarding their recent activities for the purposes of inspiring one another and for finding opportunities for collaboration. We also do a lot of discussion of issues that are of mutual concern, such as advocacy, World Vitiligo Day, within the US and internationally, as well as over the past year, of course, a lot of discussion of COVID-19. Next slide. One of the other great parts of within the GVFC are our student allies. And that's what we've termed our group of medical students who have volunteered to assist vitiligo support organizations across the country. We currently have 33 medical students involved in this, and they're connected with 14 different vitiligo support organizations. Because support groups, like everyone else, have been a little less active during the COVID pandemic, we've had to be a little bit more creative in terms of getting them engaged in vitiligo support work. And so a lot of them have been involved in patient and support group centric research. And the products of some of this research are viewable in the posters that are presented in association with this meeting. Many of them have also written articles for the Living Dappled blog. I think someone needs to mute. So there's a great need among many of our vitiligo support groups for a physician that can serve as a resource for them to answer even basic questions they may have about their vitiligo, about some of the snake oil treatments they're hearing about online. And so we have listed here cities where we need some local dermatologists or local physicians with some experience in vitiligo. So if you or someone you know is located in these areas, please do reach out to me and let us. Next slide. Outside of our vitiligo support group collaborations, we also have some really cool collaborations with other organizations, and that includes the Coalition of Skin Diseases, the NIH's National Institute of Arthritis and Musculoskeletal and Skin Diseases, and then you've already heard about our amazing partnership with my vitiligo team from Eric Peacock a little earlier. So next slide. And I guess in the interest of time, we can just quickly go through the next slide describing some of the great things we've done with my vitiligo teams, because Eric already described them quite well. World Vitiligo Day from last year, and then another plug to encourage individuals with vitiligo you're aware of to register for the virtual World Vitiligo Day event that's coming up this year. So Dr. Mzavi already touched on this, and I'm sure most of you have heard of this already, but just earlier this month, the FDA had their patient-focused drug development meeting for vitiligo. Next slide. We had over 1,000 registrants, and the agenda, the slides, the recording of this meeting are all available on fda.gov. So if you did not attend it live, I highly recommend that you review these materials because there was some really, really informative and moving discussion. And then please do let individuals with vitiligo that you are in contact with know that they can still submit comments and join the crowdsourcing campaign in order to continue to contribute to the final document that's going to be produced from this meeting. So this meeting included some really exhaustive discussion on the part of individuals who have vitiligo about the vitiligo quality of life impact and of the tremendous current treatment gaps that still exist with respect to providing treatments that are more universally effective and then also practical. So definitely encourage you to take a look at the recording. And then one of the key points I took away from this meeting was that there is a tremendous need for increased education regarding vitiligo's quality of life impact and available treatments for our non-vitiligo specializing physician colleagues. There are some disturbing stories that were shared about that situation. And then as I wind down, I did want to speak a little bit briefly about the term vitiligo patients. Because of discussions that we've had with Andre as well as others in the vitiligo support community, we've become aware over the past couple of years that there is a substantial minority of individuals with vitiligo who feel that the term vitiligo patients is demeaning and offensive because the term suggests that they are defined by their having vitiligo. And so out of respect for the members of the vitiligo community who do feel this way, we are trying to take more care, especially when addressing individuals with vitiligo, that we only use the term vitiligo patients when we're referring to individuals who are literally receiving treatment for their vitiligo. And I think that if that group of patients would understand in meetings such as this, academic or advocacy type settings, that the term patient will be used more. But outside of those situations, trying to lean on terms more like individuals or people with vitiligo is preferred. And so in the future for the GVFC, we plan to make the GVF and GVFC web pages more user-friendly. We're working on that now, trying to make them better hubs for support group contact information. We're going to continue assisting in the cultivation of leadership skills among support leaders. We actually have money budgeted for a leadership training course for later on in this year. And we want to continue to promote positive interactions between individuals in the lay vitiligo community and folks in the medical vitiligo community. Connecting local groups with physicians is going to be a big part of that. And then we plan to, most importantly, continue our dialogue with vitiligo support groups to better understand how the GVF and the GVFC can be of assistance to them. So my contact information is listed here. And next, I'd like to allow you to hear from two of our outstanding leaders in the vitiligo support community, two amazing community advocates. And we're going to start off with Valarie Molyneaux, the CEO and founder of the VitFriends Vitiligo Support Group. So Valarie, take it away.
Thank you for this opportunity. To all of you, blessings and peace. Again, Valarie out of Boston. And I didn't want to just come on and talk. I wanted you to know a little about VitFriends. And so before you is a timeline. In 2007, myself, a young woman, Patricia Rossi, now my vice president out of New York, Millicent, my leader out of Connecticut, we decided to join in 2004, that is, something called Vitiligo Support International as members. And we attended their conference in 2007. And the burden that there was nothing on the Northeast was troubling. And so we talked about it, and on our train rides back to our various states, the birthing of VitFriends, which was launched in 2009 here in Boston with those 3 women, 2 women present. We continued regular meetings from 2009 to 2015 with extraordinary guests such as Dr. John, Dr. Rich, Dr. Vanita, and several city council people out of Boston. In 2010, we asked Dr. Vanita to not only serve as advisor, but to join the board. And likewise, in 2011, we asked the same of Dr. John to serve on our board and give us guidance. In 2014, one of the city councilmen suggested that we presented before the Boston City Council, which most of them had never heard much about vitiligo. So it was a wonderful opportunity. And Dr. John was there with us to answer the heavy duty questions. And we were proud to have that. Apart from the 2009 to 2015 conferences, we broke away from Boston and did a conference in New York City with Dr. Rich as our special guest, and that was tremendous because we took our conversation to the streets of New York and shared and talked to people, and that was phenomenal. 2014, we decided to rally on the State House steps with some help from our now consultant. And it was a privilege when we shared it with Jan Valley, who was out of the country. He flew in for that, as well as Dr. John Harris. And we had that support with us on the Massachusetts State House steps. We added Meredith, that same woman, with us as our consultant. And the idea and the conversation of how well that went, we talked about taking it further. And further meant the inaugural rally on the US State House steps in 2016, for which today we still get comments. Then in spring of 2017, the idea of taking a concert to raise funds, since we had no formal support, and we raised funds to take several people with us to the next conference, which was held in Detroit in 2017. 2017 was the birthing of Pen Pal Patch. April Sawyer of Boston could not make the conference, and so she stayed at home, and in watching our videos that we all were posting live, she dreamt up and came up with Pen Pal Patch for children ages 4 to 14. In 2018, we collaborated with Dr. John Harris, and we hosted here in Massachusetts the conference for that year. In 2018, we also had the idea that enough books about vitiligo was not in the elementary schools. I was then an elementary school teacher. There was nothing in my library, nothing anywhere. And so we birthed that idea by sending out letters to several dermatologists asking for support. We were grateful enough to get a wonderful support package from financial support from VRF and 200 books that we can ship out when we shipped out the children's books. Then in 2019, oh my gosh, we headed off to Houston, Texas for our next conference. And that was an awesome I'm still touched, an awesome experience. Along with that, in 2019, everyone knew about the Tufts University, Tufts Medical situation. We took care of that. We also got a message from Eric Peacock with the idea of vitiligo, my Vit team, and he talked to myself. I brought along Alicia Roofs of Minnesota. We had that first conversation, and we said, the person with whom you need to really talk to, although you've come to us, you need Dr. Rich and others. That was 2019, and you know the story today of my vitiligo's team. We've run a podcast since 2010 to 2020, a free podcast. And in this pandemic, we wanted to do more. And so we've upgraded, and our leadership is paying for that. We're trying to raise funds, but our podcast is now 1 hour podcast. And we have global reach on that as being tracked by my co-host. In January, we also started our first teen vitiligo group called Purple Patch. The young people voted for their own name, and they chose Purple Patch Teens, supporting ages 15 through 20. And you have seen, I'm sure if you attended the FDA, 2 of our outstanding teams, one from California and one from New Jersey, and both of those parents also serves as our parent advisor to that team with our leader from Connecticut. One thing new for this pandemic we talked about is supporting the community, and so we're starting classes. First class is the first Saturday in April, is a Spanish class taught by scientists out of Puerto Rico, and several other classes. They're all posted on our website. And as you know, the COVID-19 has paused everything. So we've been able to offer Zoom sessions with a psychiatrist, with a comedian, with a psychologist, and so on and so forth. We were one of the first groups to have an 800 number, and our 800 number has a global reach. And so we are very proud of that and raising funds to continue that effort. The work that we are doing is we're passionate about. We seek your support. Right now, we're trying to raise, we're trying to go after a grant. And one of the questions they asked was, who supports us? And statistics of how many people have vitiligo. And so we have just sent out a survey. It's about 1.5 minutes to complete it. And it's when this has gone out to all the dermatologists that we know. So we do ask your support in responding to that. And if you have any questions, this is the life of VitFriends right before you and all that we have accomplished. We've left off a few things, but we're open. We're an open book, here to answer any questions, but most off to support our community. Thank you.
Thank you, Valarie and VitFriends, and you have done an amazing job supporting our community. As you can tell from the timeline and the discussion, you've been there leading, if not supporting, so many important milestones in the vitiligo support community. So we thank you for that. And then bringing us home, I would like you all to hear from Andre, who I mentioned in my presentation, Andre Joachim from Visibly, Imperfectly Perfect, to share with us another perspective on how he and his organization support the vitiligo community and what they need from us as physicians. So Andre, please.
I would like to thank you for having me as a panelist speaker. And I do want to say that I would like to thank Valarie for all her work and everything. You know, she's an inspiration to a lot of the vitiligo community out there because when I met her, she's definitely changed my life and inspired me to do more within the community. I see how much VitFriends has done for the overall community. You know, they've given us an even greater sense of community and purpose. I know when I spoke to her, when I first met her, and I told her what I did for a living, and I told her how I was a youth and family therapist, and I was in school, and she encouraged me. She said, we need people like you to speak on behalf, because mental health is such a great part of our experience. You know I've spoken about the 5 stages of grief and how we all connect to the 5 stages of grief because there's a loss of identity for individuals who have vitiligo. You know, losing your pigment, what does that mean? To people, it means like people that's turning to a different race. Some people take it as losing a sense of their own ethnicity and everything, especially when they're dark skinned or even people who are fair skinned, sometimes people are just trying to understand and figure out their place in the world and their sense of community. I do say that as individuals who are diagnosed with vitiligo, how we impact the world, how the world impacts us might be different than just say individuals who are 100% pigmented. And so when I talk to doctors and everything, Dr. Rich, you've done an outstanding job as far as clarifying that to see us as individuals, not just as patients, because when some people think of themselves as a patient, they consider that maybe someone being sick. There's a label that's already attached to that. So I think about while we're progressing as a community to advocate for individuals who are diagnosed with vitiligo, definitely using language that's appropriate at times when you're just addressing a whole huge audience of individuals who are diagnosed with vitiligo. The main point is individuals. So I thank you, Dr. Rich, for all your work in the community and letting these things be known, because, whether it be said in just in some channels of the vitiligo community, which I found out that, the vitiligo community is very vast and it's a lot. And so there's all these different support groups that is amazing, that does a great job at spreading awareness, treatment, and even embracing it. And for some people, embracing it is all we have. So, that's the best we can do. And one thing I love about another doctor, Pearl Grimes, she speaks about using more like triadic care to assess someone who's mentally ready to embrace treatment, because at the end of the day, we never know, because treatment is not 100% effective yet. So, for a cure. So it's good to be able to partner with doctors and really help someone move toward either healing or acceptance. And I think that's a huge part that needs to be looked at as far as in future research, how emotions are played out with people who have vitiligo, because sometimes there's a huge emotional response that sometimes, may come across as aggressive, may come across as someone just shutting people down, isolating, depression. I think that's something that, as a community with the doctors, partnering with individuals who are leaders in the community to help try to coordinate research efforts, a greater sense of community. And when I say there's a lot of different leaders in the community, there's, vitiligo, there's tough skin, there's other individuals in the community that we all need to partner with. And so how do the doctors reach out to individuals who are in those communities? I know because of the pandemic, it's been very hard, and a lot of activities that we normally do, we're not doing it. And even as my part as a community leader, I know there's things that I need to be on top of, connecting with doctors and everything, because everyone, like Dr. Rich has sent our way and everything, has been so helpful or has tried to help. And I think maybe that's something we need to do as far as coordinating efforts with community leaders and doctors to really try to put things together to include the whole community. I do want to say that, I know there's a big push and a big pull to get everyone together. Sometimes everyone won't be on the same page, and that's okay. I do say, as long as we keep a sense of understanding and urgency of creating a bigger support community, then we can get more things accomplished. As far as Visibly Imperfectly Perfect, we stand by as far as helping and supporting individuals through mental health, like mental health awareness, mental health I say guidelines to help individuals attain those resources within the community and help individuals as far as in accepting and understanding where they're at in their journey with vitiligo, because it's a very complex journey for everyone and it's very different for everyone. But we all, I would say we all come across those 5 stages of grief that I was speaking about earlier, whether it's sadness, whether it's shock, denial, anger, to acceptance. And I think from a global perspective, these are things that we need to try to coordinate more together and create a sense of wholeness within our community. And I think the only way we will be able to do that with the doctors who have been very involved from the start. Dr. Huggins, Dr. Harris, Pearl Grimes, and all the other doctors who've also helped out in the league. I name those because they're always prominent on my mind. So on behalf of Visibly Imperfectly Perfect and, VitFriends, Tough Skin, Vitiligo, I'd like to thank all the doctors who will help contribute to make it a bigger and a greater sense of community. And I think going forward, we can also continue to do that, but also let's focus on trying to create wholeness from a sense of mental health. And as we see during COVID times, mental health has been a huge play, and just think about the people who've been looking forward to creating family, creating community. Well, we can't do that physically right now at this point in time. So let's look forward to planning so we can create that sense of wholeness, whether through Zoom, whether it's through, talking and encouragement and, other types of platforms that encourage social media gatherings and whatnot until we can coordinate a physical space together. Thank you, everyone, for having me. And I appreciate having the ability and the presence to talk.
No, thank you. Thank you so much, Andre. Thank you, Valarie. Both of you have taught me so much personally about the vitiligo experience and how I can most support the movement that we're all trying to be a part of with finding treatments, finding a cure, just finding a way to live and cope and embrace having vitiligo. So you guys are treasures and amazing resources for the community and for me personally. And we all could talk more about all the things that we're passionate about, but with the constraints of time, we'll have to end there.